Hello everyone, my name is Tran, and today I'm going to talk about the use of mobile technology in healthcare. Today, it's not surprising to see healthcare staff using personal devices such as cell phones at work. A survey taken back in 2013 indicates that 86% of physicians use smartphones in day-to-day clinical activities. I would imagine the percentage is even higher today. That being said, it's not just smartphones being used by physicians. People are starting to bring in their own tablets and even smartwatches to help them with their daily tasks. Let's talk about some of the ways these devices are being used. One of the most controversial ways phones are being used is allowing physicians to communicate with each other via text message. Here's a question to my fellow physicians out there. How many times have you called your colleague's office number and they weren't there? Annoying, right? Texting them is much more convenient, and sometimes you get an even quicker response. Unfortunately, using text messaging to communicate patient information can complicate things when it comes to HIPAA. In 2011, the Joint Commission stated that it is not acceptable for physicians or licensed independent practitioners to text orders for patient care, treatment, or services to the hospital. Fortunately, since 2016, the Joint Commission has slightly relaxed its ruling as long as proper secure channels are used. Another great use of mobile technology in healthcare today is the ability to reach a large number of people in a short amount of time. Software and apps like AtHoc allows hospital administrators to recall or alert staff in case of any emergencies. The simple push of a button will send an alert to everyone's mobile devices. I think this is extremely useful in some cases. For example, I work at a small clinic that has 2 after-hours staff. But if there's ever a mass casualty where a lot of staff need to come back into work, one of the staff members can send the recall alert to have everyone come in. All they have to do is push a button. This way is way more effective than our old method where we would have to call each person one at a time trying to get them to come in. The last area I want to talk about is how mobile devices are becoming valuable tools in clinical decision making. Let's be honest, doctors aren't perfect and will often need help with diagnoses, medication dosages, and treatment plans. There are already apps out there that have a bunch of information on how to treat certain conditions and diseases. Most of these devices are driven by evidence-based medicine, with recommendations based on what has worked well in the past. Now, with the push for big data, there might be a change in how things are done in medicine where care is rendered through data analytics-based medicine. Having a mobile app connected to a data source that can make real-time recommendations on treatment plans with the highest success rates can be an extremely powerful tool. Unfortunately, as I've alluded to in the past slides with the HIPAA situation, the increased use of mobile devices leaves CIOs with the task of developing effective mobile strategies. One senior director of research states that we've seen a recognition by CIOs that if they don't have a mobile strategy, mobile is still going to be used. It's just not going to be controlled. It won't be under a policy. If people are going to be using mobile devices anyway, it's important for you as a CIO to develop a policy that complies with the best security and privacy practices. That way, individuals who do use their devices will have some idea of what they can and cannot do with their devices at work. With no policy in place, people could be violating HIPAA or making themselves susceptible to data breaches, which could ultimately cost your organization millions of dollars. Additionally, as a CIO, when you're implementing policies, you need to make sure such policies make workflow more efficient and improve user satisfaction. Let's use that texting example again. Physicians are using text messages to communicate regarding patient care because it's extremely fast and convenient. Unfortunately, as we mentioned before, text messaging isn't the most secure way to communicate patient information. If you're going to implement an alternate policy on how doctors can communicate patient information, it better be just as easy and convenient as text messaging, or people are not going to want to use it. People will not be satisfied if they have to download an app and enter their password 10 times a day just to send a 5-word text. Alright, so if you didn't pay attention to any of the other slides, here are the take-home points. Mobile devices are useful as a convenient means of provider communication, a quick way to recall and alert staff, and for assisting with clinical decision making. Whether or not there's a mobile strategy or policy in place at hospitals, people are going to be using these devices regardless. which is why it's important to get ahead of the curve and implement appropriate strategies and policies to minimize risk for security and privacy breaches while maximizing productivity and workflow. Thank you very much. Here are my sources, and have a great day.